All right, guys, so I'm going to be going over how to set up a sterile field. So this, you might hear the term sterile used interchangeably with aseptic, okay? Aseptic is the term we use more often, but sometimes I switch back into using sterile. First thing we need to do is get our dressing trolley or our procedure trolley. Generally, we prefer not to use patients' bedside tables because that's what they eat off of. So if I'm setting up my aseptic field for catheters, wound care, etc., I should grab one of the procedure trolleys. Now, because I don't know what's been used last on here, what I am going to do is wipe it down, okay? Personally, anytime I use wipes, I always use gloves because a lot of the wipes in the healthcare facilities have bleach in them. Oh, these ones aren't open. And I don't want to get bleach on my skin, okay? Perfect, thank you. So I always wear gloves, and you just give it a thorough wipe, and it should be wiped before and after any procedure, okay? Let it air dry, and then that goes in my rubbish bin. All right, so now I've got my sterile field. What I'm going to do is hand hygiene before I go to set it up. Bring it all to the patient's bedside. If you're dealing with a wound, you might choose to uncover the wound first before you set up your aseptic field, or you may choose to set up your aseptic field and then uncover the wound. It's entirely up to you and the situation that you are dealing with. When I open my dressing pack, I can touch this with my bare hands. It's still protected, okay? This one we've already used before, so it's not as folded neatly, but what you're gonna find is there's gonna be a triangle, a tip that you can pull and open. And then there's going to be another tip that you can pull and open. And you only touch the edges, okay? Now I like to square off my aseptic field because if I leave it like this, as soon as this part dangles below my waist, it becomes contaminated. The rules with an aseptic field is anything below the waist is considered dirty. If I turn my back to it, because I don't know what's been going on, now it's contaminated, okay? If I spill water on it, that area becomes contaminated unless it's an aseptic field that has plastic underneath, which most of them do not. The reason with the fluid or water spilling is it allows bacteria to more easily come through the paper, okay? Also, there is a 2 centimeter border along here. That is considered dirty. So that allows me to touch it with my bare hands, but I can't go past that 2 centimeters and touch inside, okay? Any questions about that? So the way it's set up, there's always going to be yellow forceps sitting on the top. I'm going to very carefully reach in and grab these yellow forceps without touching anything else, and I'm only going to touch the tip. Now the tip of these yellow forceps are now contaminated. However, the bottom end is not. So if at any point I want to put these forceps down, I put it so that half is off of my aseptic field and the sterile part is inside my aseptic field, okay? I'm going to use these to set up my tray. Set that aside. Sometimes your sterile kits will come with gauze, like so. Other times they'll come with cotton balls. Gauze is more common. What I recommend is that you always bring some extra packages of gauze if you need it to put on your sterile field, because sometimes you might not have enough. You always come with an extension sterile field. So this, if I pull it open, so again, the same rules with the border apply. So I can now touch the edge of this, put that down carefully, okay, pull it open. This is an extension of my sterile field. So if I have another table, I can put it on and I can put sterile equipment on if I need to, or I can even put it on the patient's bed if I need to, such as between their legs if I'm doing catheterization. Some nurses will use this, some will not. Either way is okay. I am going to just put it down here for now. All right, what I like to do when I'm setting this up, I actually like to take everything out of my tray. And personally, I like to stand up my forceps so they're a little bit easier to grab, but you do not need to do that, okay? Now I'm going to add my cleaning solution to my field, okay? Depending on what you're going to clean the wound with, it might be chlorhexidine, it might be a pink solution, okay? It might be providine, which is a brownish iodine type solution. It might be sterile water, or it might be normal saline. Some of them come in little bottles. You can use your little squeeze bottles for the normal saline, or you can use a big bottle, okay? If you're using a big bottle, just be careful how you pour. You do not want, a lot of students make a mistake of having their bottle touch the paper. You need to hold it high enough so it doesn't touch. Pour it into the tray. Personally, I prefer to pour it into a small section of the tray rather than the big section. Put the lid back on. If it does splash, that area is contaminated. Move everything away from that particular area, okay? Now that I've got my aseptic field set up, if there's any additional equipment such as syringes or dressings that I need to add on, I will add them on. There's two ways that you can add it on. You can peel down the wrapper, okay? Let me get a syringe as an example. Two different ways you can do it. You're going to peel open the wrapper and you're just going to drop it on. Now the outside of this wrapper is contaminated, so I don't want to let that touch my aseptic field. The other way is if you've got gauze or a dressing or something, again you do your peel and you hold it like you would a banana, okay? And then you're going to take your forceps where the tip is still sterile and you're going to pull it out. This is actually the best practice way of doing it. However, sometimes you can't pull stuff out. In that case, that's when you do the peel and dump, okay? It's two different ways to go about it. Once you've got everything set up the way it should, now it's time to make sure that my patient is prepared for whatever I'm doing. If I need to remove the dressing or set them up for the catheter, I'm going to do that, wearing clean gloves as needed. Then I'm going to do hand hygiene, okay? Make sure your hands are really thoroughly dry now before you move on to the next step of applying your sterile gloves, okay? If you have any rings on, bands are usually okay in your sterile gloves. However, if you've got a diamond that's sharp, it might slice through the glove, so you do need to be conscientious of that and you may need to remove it. They're also not known for being very hygienic, so ideally if you can remove your rings, you do. Okay. There are a couple of different types of sterile gloves. They do come in different packaging, but you can always open the package and they're always set up with an inner package. With the inner package, you may do this on the patient's bedside table, or you may even do it on their bed as long as they don't contaminate it. This is just a 2-minute process and then that space will become available to them again. I'm going to open it up. Okay. Now the gloves always have it so that the cuff is folded over, so the part that's going to be directly touching my skin is on the outside. So I can actually pick it up, okay, and I can touch the cuff here because that's going to touch my skin. Again, it must be above my waist. Anything below the waist is considered contaminated. I'm going to put it on. Now there's two ways to deal with this. I can either pinch and pull it down and leave it as, and that's as far as I can go, or I can leave it as is. What I don't want to do is be touching with my bare hand the outer part of the glove, okay? Then here, I didn't touch the side of the paper, so it is still sterile. I can touch it, okay? I'm going to slip my gloved hand underneath and pull it out. Now if it's stuck or anything, I can now use this hand to hold it. Just make sure that these two don't touch each other. Pull it out. What I want to make sure is that although this part is sterile right now, it's going to be touching my skin. So keep your thumb up like you're hitchhiking. Slip your hand in, and that's it. See how it's curled under? I'm not going to fix that. Now I've got my sterile gloves on, okay? Again, it must be kept above my waist. With my sterile gloves, I can touch anything in here. So before you asked me the question of, do you have to wear sterile gloves for all wound care? The answer is no, okay? But if I do wear sterile gloves, I can easily touch everything and not need to worry about using the forceps until I'm ready to go to the patient. If you are not wearing sterile gloves, okay, and you've set up your sterile field, just give me 1 minute, I'll get clean gloves. This is what we call no-touch technique with wound care. So everything in here is sterile. I'm going to pick up these forceps, and now this end of the forceps becomes contaminated because these clean gloves are not sterile. And this end also becomes contaminated. But I can do everything, such as prep my cotton balls or my gauze. Okay? And I prep it all in advance, and then when I go to look after the patient, I'm just using the tip of the forceps that still remains sterile. 2 different ways of doing it. If you're wearing those sterile gloves, you can physically get your hands in here and do everything you need to. If you are only wearing clean gloves, hands stay on the forceps, they do not touch anything in your sterile field. Any questions about that?